How can you tell if an elderly loved one is nearing the end of their life? It's a question many of us dread, but one that carries profound importance. As our parents, grandparents, or other cherished elders age, subtle changes in their health and behavior can signal that they may be entering their final year. Recognizing these signs isn't about fostering fear, it's about preparing with love, compassion, and practicality. Understanding these warning signals is crucial for both emotional and practical reasons. On an emotional level, it allows us to cherish every moment, offer comfort, and ensure our loved ones feel supported during this tender phase of life. Practically, it helps families make informed decisions about care, medical needs, and end-of-life arrangements, reducing stress during an already challenging time. This topic is deeply personal and often difficult to discuss, but ignoring these signs can lead to missed opportunities for connection and care. By being aware of the subtle shifts, whether it's a decline in energy, changes in appetite, or increased withdrawal, we can respond with empathy and ensure our loved ones' final days are filled with dignity and peace. In this video, we'll explore 5 subtle signs that may indicate an elderly person is in their final year. These insights are not meant to alarm, but to empower you with knowledge, helping you navigate this delicate journey with grace and understanding. Sign number 1. Sudden and severe weight loss. Have you noticed your loved one losing weight rapidly without explanation? Sudden and severe weight loss in the elderly is more than just a physical change. It's often a red flag signaling deeper health concerns. While gradual weight loss can be a natural part of aging, a dramatic drop in weight over a short period is a significant warning sign that should never be ignored. It could point to serious underlying conditions such as cancer, organ failure, or malnutrition, all of which require immediate attention. To understand why this happens, consider the body's natural processes. As we age, metabolism slows and appetite may decrease, leading to gradual weight changes. However, when weight loss is sudden and severe, it often indicates that the body is struggling to function properly. For example, cancer can cause the body to burn calories at an accelerated rate, while organ failure or chronic illnesses can disrupt the ability to absorb nutrients. Even depression or dental issues, which are common in older adults, can lead to a lack of interest in eating, further exacerbating the problem. Imagine 2 scenarios. In the first, an elderly person loses a few pounds over several months due to reduced activity and a smaller appetite. This is typical of aging. In the second, an elderly person loses 10 to 15 pounds in just a few weeks, appearing noticeably weaker and frailer. The latter scenario is a clear signal that something is wrong and warrants immediate medical evaluation. If you notice sudden weight loss in your loved one, take action. Start by consulting their doctor to rule out or address any underlying conditions. In the meantime, focus on their nutrition. Offer calorie-dense, nutrient-rich meals and snacks, such as smoothies with protein powder, nut butters, or avocado. Encourage small, frequent meals if they struggle with appetite. Hydration is also critical, as dehydration can worsen their condition. In the context of the final year of life, sudden weight loss can be a sign that the body is beginning to shut down. This doesn't mean giving up hope, but it does mean preparing to provide the best possible care and comfort during this time. Next, we'll talk about another subtle sign: increased fatigue and changes in sleep patterns. Understanding these shifts can help you better support your loved one as they navigate this delicate phase of life. Sign number 2. Increased fatigue and sleep patterns. Is your loved one sleeping more than usual or struggling to stay awake? Changes in energy levels and sleep patterns are common as people age, but when fatigue becomes overwhelming or sleep habits shift dramatically, it's a sign that deserves closer attention. Increased fatigue and altered sleep patterns can be key indicators of declining health, reflecting the body's natural process of slowing down as it prepares for the final stages of life. Fatigue in the elderly isn't just about feeling tired. It's often a sign that the body is conserving energy for essential functions. As organs and systems begin to slow, the body prioritizes vital processes, leaving less energy for daily activities. Similarly, changes in sleep patterns, such as sleeping most of the day or experiencing restless nights, can signal underlying issues like pain, medication side effects, or even the progression of chronic illnesses. Consider two scenarios. In the first, an elderly person takes a short nap in the afternoon, but remains active and engaged throughout the day. This is a normal part of aging. In the second scenario, an elderly person sleeps for hours during the day, struggles to stay awake during conversations, and has little energy for even simple tasks like eating or bathing. This level of fatigue is a clear indication that their body is undergoing significant changes. If you notice these shifts in your loved one, there are steps you can take to support them. First, ensure their sleep environment is comfortable and conducive to rest. Think soft bedding, a quiet room, and dim lighting. Monitor for signs of pain or discomfort that might be disrupting their sleep, and consult their doctor to address any medical concerns. Gentle activities like short walks or light stretching can help maintain some level of energy, but be mindful not to push them beyond their limits. In the context of the final year of life, increased fatigue and changes in sleep patterns often signal that the body is conserving energy for its most critical functions. This doesn't mean giving up on quality of life, but rather adapting to their needs and providing comfort and care during this time. Next, we'll discuss another subtle sign: withdrawal from social activities. Understanding this change can help you better connect with your loved one and provide the emotional support they need. If you're still watching this video and finding these insights valuable, please comment where are you watching to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Now let's move forward. Sign number 3: withdrawal from social activities. Has your loved one stopped attending family gatherings or lost interest in hobbies they once enjoyed? Social withdrawal in the elderly is more than just a preference for solitude. It's often a significant warning sign of emotional, mental, or physical decline. When an elderly person begins to isolate themselves from friends, family, and activities they once loved, it can indicate deeper issues that need attention and care. Withdrawal from social activities is a key indicator of declining health because it reflects changes in both the mind and body. Emotionally, it may stem from depression, anxiety, or a sense of loss as they confront their mortality. Mentally, it could be linked to cognitive decline or the overwhelming effort required to engage with others. Physically, fatigue, pain, or illness may make socializing feel like an insurmountable task. Together, these factors can create a cycle of isolation that further impacts their well-being. Consider two scenarios. In the first, an elderly person enjoys occasional quiet time but still participates in family events, chats with friends, and pursues hobbies. This is a healthy balance. In the second scenario, an elderly person refuses to leave their room, avoids phone calls, and shows no interest in activities they once cherished. This level of withdrawal is a clear signal that something is wrong and requires compassionate intervention. If you notice your loved one pulling away from social interactions, there are steps you can take to help. Start by gently encouraging small, low-pressure social activities, such as a short visit from a close friend or a quiet family dinner. Create a supportive environment where they feel safe and valued, and avoid pushing them too hard, which could lead to further withdrawal. If depression or anxiety seems to be a factor, consider seeking counseling or therapy to address these emotional challenges. Sometimes, simply being present and offering a listening ear can make a world of difference. In the context of the final year of life, social withdrawal can signal that the person is preparing emotionally and mentally for the end of their journey. It's a deeply personal process, and while it may be difficult to witness, respecting their need for space while offering unconditional support is crucial. Next, we'll explore another subtle sign: changes in cognitive function. Understanding these shifts can help you provide the care and compassion your loved one needs during this tender time. Sign number 4: changes in cognitive function. Have you noticed your loved one becoming confused or forgetful? Changes in cognitive function, such as memory loss, difficulty concentrating, or confusion, are more than just signs of aging. They can be critical indicators of declining health. While occasional forgetfulness is normal, significant or rapid cognitive decline often points to deeper issues such as dementia, Alzheimer's disease, or the body's natural slowing down process as it approaches the final stages of life. Cognitive decline is a key indicator of declining health because it reflects changes in the brain's ability to function. Conditions like dementia or Alzheimer's can cause progressive memory loss, disorientation, and difficulty with daily tasks. Even in the absence of these conditions, the brain, like other organs, may slow down as the body prepares for the end of life. This can lead to increased confusion, trouble communicating, or difficulty recognizing familiar people or places. Consider two scenarios. In the first, an elderly person occasionally forgets a name or misplaces their glasses but remains fully engaged and capable of managing their daily life. This is a normal part of aging. In the second scenario, an elderly person struggles to recognize family members, forgets how to perform routine tasks like dressing or cooking, or becomes easily agitated and disoriented in familiar settings. This level of cognitive decline is a clear signal that their brain health is deteriorating and requires attention. If you notice these changes in your loved one, there are steps you can take to support them. Create a calm and structured environment to reduce confusion and anxiety. Use memory aids, such as labeled drawers, calendars, or reminder notes to help them navigate daily life. Be patient and compassionate when communicating, and avoid correcting or frustrating them if they make mistakes. Most importantly, consult their doctor to determine the underlying cause of the cognitive decline and explore potential treatments or support options. In the context of the final year of life, cognitive decline often signals that the brain is slowing down, much like the rest of the body. This can be a difficult and emotional experience for both the individual and their loved ones, but understanding and addressing these changes can help ensure they feel safe, supported, and cared for during this time. Next, we'll discuss another subtle sign: frequent hospitalizations or health crises. Recognizing this pattern can help you better prepare for the challenges ahead and provide the best possible care for your loved one. Sign number 5. Frequent hospitalizations or health crises. Has your loved one been in and out of the hospital recently? Frequent hospitalizations or recurring health crises are more than just a series of unfortunate events. They are significant warning signs that the body is struggling to maintain its normal functions. When an elderly person experiences repeated health setbacks, it often indicates that their body is no longer able to recover fully, signaling a deeper decline in overall health. Frequent hospitalizations are key indicators of declining health because they reflect the body's diminishing capacity to heal and sustain itself. As we age, our organs and immune systems become less resilient, making it harder to bounce back from illnesses, infections, or injuries. Each health crisis can take a greater toll, leaving the body weaker and more vulnerable to the next one. This cycle often points to the final stages of life, where the body's systems are gradually shutting down. Consider two scenarios. In the first, an elderly person catches a cold or suffers a minor injury, but recovers fully after a short period of rest and treatment. This is a normal part of aging. In the second scenario, an elderly person is hospitalized multiple times within a few months for issues like pneumonia, heart failure, or severe infections, with each recovery being slower and less complete than the last. This pattern of frequent health crises is a clear sign that their body is nearing its limits. If your loved one is experiencing frequent hospitalizations, there are steps you can take to support them. Work closely with their healthcare providers to understand their prognosis and explore options for care, whether that means aggressive treatment or transitioning to comfort-focused care. Focus on maintaining their quality of life by managing pain, ensuring they're comfortable, and addressing their emotional and spiritual needs. It's also important to prepare for end-of-life decisions, such as creating or updating advance directives to ensure their wishes are respected. In the context of the final year of life, frequent hospitalizations often signal that the body is nearing the end of its ability to sustain life. While this can be a difficult reality to face, recognizing this pattern allows you to provide the best possible care and support during this tender time. Finally, let's wrap up with some key takeaways to help you navigate these subtle signs and provide compassionate care for your loved one. Recognizing the subtle signs that an elderly loved one may be in their final year is both a challenging and deeply important responsibility. We've explored 5 key indicators: sudden and severe weight loss, increased fatigue, and changes in sleep patterns, withdrawal from social activities, changes in cognitive function, and frequent hospitalizations or health crises. Each of these signs serves as a gentle yet powerful warning, helping us provide the care, compassion, and support our loved ones need during this tender phase of life. If you notice any of these signs in your loved one, don't hesitate to seek professional guidance, consult their doctor, explore care options, and ensure their physical, emotional, and spiritual needs are met. While this journey can be emotionally overwhelming, remember that you're not alone. By staying attentive and proactive, you can make a profound difference in their comfort and quality of life. It's never easy to confront the reality of a loved one's declining health, but your love and presence are the greatest gifts you can offer. Take comfort in knowing that you're providing them with dignity, care, and peace during this sacred time. Thank you for taking the time to learn about these important signs. If you've experienced any of these with your loved one, or if you have questions, please share your thoughts in the comments below. Your stories and insights can help others feel supported and understood. Together, we can navigate this journey with compassion and hope.